First off, I want to thank two people who were unable to attend today. State Senate Budget and Fiscal Review Committee Chair Holly J. Mitchell of Los Angeles and Assemblymember Joaquin Arambula of Fresno. Their help, along with Dr. Richard Pan, who will join us briefly, was critical to ushering in the Community Clinic Lifeline Grant Program in our new state budget. I also want to thank all of the men and women who work for and support the survival of community health clinics throughout our state. Funding for vital healthcare services for the underserved and vulnerable communities is being threatened today by a Republican-controlled Congress and President Donald Trump. Washington is poised to slash budgets for a range of programs, such as family planning and preventative services, maternal and child health programs, and Medicaid. President Trump's budget proposal will prevent Planned Parenthood clinics from participating in any federally funded health program. The restriction could hobble services at 112 clinics around the state, serving 850,000 women. Additionally, efforts to repeal the Affordable Care Act would force many people off the insured rolls and into overstressed community clinics. Washington's anti-immigrant rhetoric is scaring people who are eligible for Medi-Cal and covered California subsidies from applying. Instead, they are once again becoming uninsured and forced to rely on community and Planned Parenthood clinics for care. This Trump scare is already putting a tremendous burden on the state's safety net. Fearing deportation and already weary of reporting crimes or testifying in court, we want to be prepared to deal with this vulnerable population's healthcare needs through our community clinic network. Nonprofit, community-based clinics, including Planned Parenthood, are the backbone of this state's healthcare safety net. They provide basic medical and preventative services for 1 out of 7 Californians, regardless of their ability to pay. 80% of those patients earn less than twice the federal poverty level, and about a third of them are children, and 3/5 are women. Tearing apart that safety net would have enormous consequences, leaving many poor and working poor people without primary and preventative care and no option for treatment other than costly emergency room visits. Do not be fooled. Those costs are passed on to Californians through higher healthcare costs and insurance premiums. Though this prognosis is grim, here in California, we will not let our most valuable citizens be the victim of Trump care and Trump scare. My office has come up with a creative plan to lessen the cut's impact. We are excited to announce that included in the new state budget just passed by the legislature is $20 million for the Community Clinic Lifeline grant programs. Grants provide financial support for vulnerable clinics facing the prospect of severely reduced services or shutting their doors. A total of up to 80 clinics will be eligible for maximum grants of $250,000. The grants will support core operations so that clinics can continue serving patients while they develop new alternative funding sources such as private foundations, local businesses, or public-private partnerships. The $20 million will help many of these clinics remain open while state lawmakers figure out how to compensate for lost federal support. We cannot ensure that all the clinics survive, but at least we can buy some time to keep as many open as possible. This money comes from principal and interest payments accrued over the last 15 to 20 years by a loan program for nonprofit small or rural health clinics. The Help To program is administered by a financing authority that I chair. These community clinics nobly serve the poorest patients in our state. They should not be forced to shutter their doors if President Trump and Congress repeal and replace Obamacare with their version of wealth care. Finding ways to keep people healthy is part of who we are in California. We do not turn our backs on those in need. We provide a helping hand so that men, women, children, and undocumented immigrants continue to have the access to the basic healthcare services they require. And it's now my incredible privilege to introduce a champion for healthcare throughout the state of California, a medical doctor, somebody who is a leading light on these types of policies. I want to welcome and thank Senator Richard Pan for his leadership on this issue.
Thank you. Thank you so very much, Treasurer Chung, for your leadership and securing this much-needed funding in the state budget. As we have worked here in California to really expand healthcare coverage and also to improve healthcare access here in the state of California, we know that there are many people who are out in our communities, our neighborhoods, who really would benefit and need the health care that they are currently receiving through our Medi-Cal program with the Medi-Cal expansion because of the Affordable Care Act. My mother always said, if you don't have your health, you don't really have anything. And that's why it's so important we work hard to be sure people continue to have access to health care. And certainly one of the most fundamental parts of being sure people have access are our community clinics. And I'm proud to, as a physician, a pediatrician, to practice at a community health center and to spend much of my career practicing in community health centers. In fact, 30% of Medi-Cal patients are enrolled in community clinics, and that represents about 6 million Californians. These clinics are essential to be sure that anyone who walks through the doors can get help for their health needs. But unfortunately, in Washington, D.C., the GOP Congress, we're still waiting to hear from the Senate. President Trump is actually working to limit access to health care. Not only, of course, are they proposing through the HCA to repeal Obamacare, basically eliminate or phase out the Medi-Cal expansion, they actually are going after the Medicaid program itself. So not just the Obamacare, but actually going back to the founding of the Medicaid program by proposing block grants or per capita block grants, which will actually reduce access for people across not only California, but the entire United States. In fact, the Congressional Budget Office estimated about 23 million Americans would lose health care coverage. So even as Washington is looking to actually take away health care from people, I'm proud to partner with Treasurer John Chung, with my fellow members of the Budget Committee, Budget Chair Holly Mitchell, to continue to work to be sure we expand and improve access to health care. And this Community Clinic Lifeline program is an example where California is stepping up, even as others in Washington are threatening to let us down. Our community clinics are simply too important. They're on the front lines of delivering health care, taking care of our most vulnerable citizens. So we need to continue to take action to prevent their closure. These low-interest loans would support core operations to allow clinics to continue to provide care to their patients. Even while our clinics are working for more long-term solutions, we have worked through the budget also to try to improve reimbursements as well. But here in California, we will continue to work to find smart solutions to help address the needs of Californians. So I'm proud to be here, and I want to thank again our treasurer for his continued ingenuity and his problem solving to work with the legislature to be sure we protect the people of California and to ensure that they get the care that they need. Thank you. Thanks very much.
Thank you, Dr. Senator Pan. Next, it's an incredible privilege to introduce Cathy Kinnear. As an aside, Cathy is retiring after decades of extraordinary service to the people of the state of California through her work as CEO of Planned Parenthood affiliates. On a personal level, I thank Cathy since my early tenure as an attorney in Gray Davis's office, from the bubble legislation to blue penciling the family planning budget to the crisis in 2008, 2009. You have been a stalwart champion. So thank you for Planned Parenthood's partnership on this issue and your incredible work. So happy to hear your comments.
Thank you.
Thanks, Cathy.
Thank you so much, Treasurer Chung. It has been an honor and a privilege to work on behalf of the women and men of California who rely on Planned Parenthood to provide the quality reproductive health care services they all deserve. As you know, California has spent some challenging times with its budget, and we are very fortunate that the governor and working with Secretary Treasurer Chung have come together to find a way to provide some core support grants, transitional in nature, to help us through these challenging times and uncertain times with what's going on at the federal level. You know, every day our patients who come to us know that we're oftentimes the only healthcare provider for their reproductive healthcare needs. And they express that gratitude to us, saying they're very afraid about what's going on in DC and is that going to cost them access to Planned Parenthood. And what we tell them is that we're fighting every day at the federal level and we're partnering every day at the state level to make sure that they will continue to have access to reproductive health care services. This grant program is a small but important part of our ability to keep our health centers open. And we are so appreciative to the treasurer and to the governor for continuing their support for women and men access to quality reproductive health care services. So on behalf of our patients, thank you very much and have a good day.
Thank you, Cathy. Now it's my privilege to introduce Carmella, Cassiano, Garcia, President and CEO of the California Primary Care Association. She has a deep sense of the impact on residents throughout this state, especially those who are disadvantaged. And so your perspective and your leadership on this issue has been critical. And again, thank you.
Good afternoon. As was stated, I'm Carmella Cassiano Garcia, President of the California Primary Care Association and California Health Plus Advocates. We are so honored to be participating in this event today. I certainly want to start by thanking our treasurer, John Chung, and his office for their tremendous leadership on establishing this very critical program and for their continued commitment to community health centers and their recognition of the critical role that we are playing in providing health care to Californians. Today, our community health centers provide health care to more than 6 million patients. That's 1 in 7 Californians is getting served in our health centers. And with the expansion and coverage under the Affordable Care Act, that's a growing number of Californians, particularly those in Medi-Cal, who are choosing community health centers as their provider of choice. We have certainly enjoyed tremendous success with the implementation of the Affordable Care Act here in California, setting example for the entire country. Millions of uninsured residents now have coverage and access to these needed and vital services. And community health centers, who are open-door providers, providing care to all, regardless of their immigration. Our community clinics and health centers, in fact, the entire state of California has enjoyed tremendous success under the Affordable Care Act, serving as an example for the entire country. Millions of previously uninsured residents now have access to coverage and care and healthcare services. And our community health centers have been at the forefront as open-door providers that provide care to everyone, regardless of their immigration status, their ability to pay, their ethnicity, their income. Our community health centers are leaders, and we have helped to show that the ACA is working in California. But unfortunately, as we all know, that progress is being threatened at the federal level. If the American Health Care Act repeals the ACA, it will roll back our Medi-Cal expansion. And if Congress doesn't fix the primary care funding cliff by this fall, millions of Californians will lose access to health care as community health centers are at the brink of losing 70% of their federal funding. The state could lose 27,000 good jobs in community health centers alone, and a $3.8 billion hit is threatening our state. And this is why the treasurer's funding and commitment is so important to California, in particular our vulnerable populations, with the overwhelming majority of our patients being low income, living in rural communities, and being from ethnic communities in California. Surprisingly, the vast majority of people without access to primary care actually have insurance, but some have few or limited options of where they can get their care locally. And this funding will help ensure that our health centers in California remain viable and are provided with transitional operational support to keep their doors open, no matter the outcome of this devastating federal legislation. Community health centers are economic drivers in our lowest need communities where they have jobs and economic revitalization, and community health centers are a part of that. Insurance premiums may rise and insurers may lead the market, but health centers are committed to remaining anchored in their communities and providing affordable and preventive care to all. As the nation's healthcare system faces uncertainty, California must step up to the plate and ensure access to care at a statewide level. And that's exactly what this funding is doing. It is part of California's tremendous leadership and efforts to step up to the plate and ensure that our most vulnerable populations are protected. So again, I want to thank the Treasurer's Office and the legislature for recognizing the importance of community health centers and investing in our future. Thank you.
Thank you, Carmella. And now we'll have Christopher Galliano from the California Immigrant Policy Center share his thoughts and comments.
My statements will be brief, but access to healthcare has always been vital to the well-being of the immigrant communities. The federal administration is actively targeting immigrants with executive orders, ramping up anti-immigrant policies as well as scare tactics. This has resulted in fear and anxiety, which has affected immigrant communities' ability to seek care. We're seeing a lot of individuals afraid to go out in public to go do their doctor visits. We're hearing about a lot of folks wanting to disenroll from public benefits programs. Yet, in the same context, many immigrant families depend on rural clinics in order to access healthcare services, especially those in their language. This budget investment will help better serve immigrant communities by ensuring that they continue to have access to health care despite the federal administration's actions. We just wanted to thank Treasurer John Chung as well as our legislative leaders, including Senator Dr. Pan, for their efforts in championing this issue, as well as our partner advocates. Thank you.
Are there any questions? We want to make sure that California is ahead of the. So the question is, the Congress has not taken action on the Affordable Health Care Act. The United States Senate, we know that the Congress passed it. We want California to be proactive, ahead of the curve. We know that if that passage happens, you're going to have devastating consequences, as articulated by all the speakers, whether it's job loss in California, loss of access of up to $24 billion on an annual basis for critical health care needs in the state of California. If we don't take action, California will be behind the curve if that action succeeds. So we want to be smart and proactive. That's correct. Yes. So there will be revenue criteria by which to participate. There'll be revenue criteria by which to participate. Over the next 6 months, the appropriate authority, CHIFA, will examine and establish that criteria, and about 6 months out, we'll start taking the applications and awarding grants thereafter.
So these community clinics and Planned Parenthood offices, they need to apply.
That's correct.
And for those 3 or so clinics that have shut down, will they possibly reopen? Could they reopen with this money?
When we establish that criteria, that will be contemplated.
How much would it take to reopen a clinic that's already closed?
I think it depends on each of the particular clinics. I don't know if Cathy wants to go into the details. I don't want her to the answer if she doesn't want to choose to do so.
It's hard to estimate now It's hard to estimate what it would take to reopen a health center that's already closed because there are many factors. The number one being your staff, if you've relocated them to other health centers. So we would have to evaluate the ability to reopen a health center once we know the criteria of the grant. But we have many who are on the cusp of closing, and those are the ones I think we would want to really make a priority to make sure that we don't lose any further access. And that's why this important funding would do exactly that.
How many total have closed?
At Planned Parenthood, we've had 3 that have closed, but we've had others that have had to reduce hours and availability. There's also a local women's health specialist health center that closed at Sacramento location. So we hope with the provider rate increase that was in the governor's budget, along with this money, will give the health centers the confidence they have to have financial stability to carry them through these uncertain times.
And this may be an answer for you or someone else, but who or what determines who gets
The board at California Health Facilities Financing Authority, once we establish the criteria, will review the applications and see and identify the most compelling cases to finance first. It'll be established over the next 6 months. Did either one of you want to make comments? No? On the impacts?
What's the big difficulty here in all this moving forward?
The big challenge is trying to make sure that we can keep these critical clinics alive and afloat during this incredibly difficult period of time. Keeping them afloat so that you have Californians who are at extraordinary risk and in harm's way because of the actions that are being proposed in Washington, D.C., from withdrawing from mainstream society and going out and getting access to the health care that is critically needed. So at the end of the day, once again, it's protecting our fellow Californian.
I think the foresight on a fund like this is so important in these critical times because once a clinic is closed, you've lost those doctors, you've lost that infrastructure, you have lost that facility. It can take up to a year to hire a physician in a community health center. So what's so important about these dollars, if they can keep the clinics afloat and help get through a critical time, a transitional opportunity, that is a much more efficient use than having these clinics closed and trying to reopen. That is very, very challenging and in fact rarely happens. Would be eligible? Well, we have several hundred community health center corporations, over 1,000 sites in the state. So it's a very large, vast network of community health centers in California.
I think, one of the really essential things, and I'm sure Carmella can correct me if I'm, is that a community health center actually has to accept all patients who show up. So what will happen is that if Congress does go forward and cap Medicaid and Medi-Cal, limits the expansion, many of those 23 million Americans, including millions of Californians, become uninsured, may still show up at clinics, even without the health insurance coverage, except, unfortunately, their ability to pay, which will be on a sliding scale per federal rules, may cause challenges for the clinic to keep their doors open. And so this provides vital support for those clinics so they can continue to run. As was mentioned, it's hard to reopen a clinic once it's closed. So I know that was asked, Congress hasn't done anything yet. They haven't done anything at the federal government level. But actually, I think the uncertainty and the possibility that something would happen is something we need to prepare for so that we're not caught unprepared. Now, will this solve all the problems? No. But this is a step in saying that there are things California can do. And I, again, want to thank our treasurer for working this out, is saying like we should be working to continue to improve access to health care here in the state of California, no matter what Washington does. We're going to continue to move forward, and I appreciate the leadership of Treasurer Chung in saying, here's an opportunity for us to do that, whatever happens in D.C. And that's why this is so important. Thank you.
Further questions? As iterated and stated earlier, right, we don't have to wait just for the repeal of the Affordable Care Act or partial repeal, right? The actions today, whether it's on immigration, whether it's talking about changing the formulas for how much we're receiving today, right? When you look at the change from Medi-Cal expansion from just the sliding scale, but going back to the historical norm at 50%, all has a dramatic impact on people coming forward to getting access and the ability to pay for the clinics who provide those services. Okay. With that, the speakers are available. Oh, yeah, please. Oh, please.
So I think other than focusing on the actions of the federal administration and being prepared to respond, I think it's also important to take into consideration the fact that this money will go towards making sure that these clinics are sustainable in the long term and that they, in the future, don't remain as dependent on federal funds as they are right now, so that in the future we don't have to revisit this kind of issue, and that not only are these clinics strengthened in terms of what they're able to provide and the like, but that they aren't dependent on a GOP Congress who is not friendly towards, in particular immigrant communities and other communities. So I think that it's just a very important part to highlight of this funding, is that it will go towards ensuring that these clinics remain open and sustainable towards the future.
Very good. Any other questions? Okay. Thank you all very much for coming.